Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 049. During examination of 4-month-old child with meningococcemia presence with acrocyanosis, cold extremities, tachypnea, and thready pulse, blood pressure of 30/0 of a millimeter Hg, anuria, and sopor. What clinical syndrome is it? A. Toxic shock syndrome. B. Exicosis. C. Encephalic syndrome. D. Acute renal failure. E. Neurotoxicosis. Meningococcemia is an infectious disease characterized by upper respiratory tract infection. Symptoms include sudden intense headache, nausea, vomiting, chills, fever, skin rash and lesions, eye and ear problems, and possibly a shock. Shock is the body's response to a sudden drop in blood pressure, by vasoconstriction in the extremities, that helps conserve blood flow to the vital organs. Reduced cardiac output in heart failure and shock can lead to acrocyanosis, peripheral cyanosis, if severe. Toxic shock syndrome is a life-threatening condition characterized by a high temperature, flu-like symptoms, diarrhea, a widespread sunburn like rash, difficulty breathing, and confusion, caused by bacteria getting into the body and releasing harmful toxins. Encephalopathy is the brain damage or disease in which a change in the way the brain works or a change in the body that affects the brain occurs, that leads to an altered mental state, leaving the patient confused and not acting like the person usually does. Exicosis is insufficient intake of fluids, resulting in dehydration. Acute kidney failure occurs when the kidneys suddenly become unable to filter waste products from the blood. When the kidneys lose their filtering ability, dangerous levels of wastes may accumulate, and the blood's chemical makeup may get out of balance. Neurotoxicosis is neurological dysfunction caused by neurotoxins. The answer is A. Toxic shock syndrome.